Hi, I'm Dr. Arthur Hatch. I want to talk to you today about lumbar epidural injections. Lumbar epidural injections are probably the most common injection performed across the United States for low back and leg pain. The low back and leg pain usually stems from either having a pinched or irritated nerve in your low back. It's very rare that people in today's world throughout the course of their life won't have to deal with this at some point. The injections here at Desert Spine and Sports are performed in office. The X-ray tech will bring in our low-dose X-ray machine or fluoroscope and begin to take a series of pictures of your low back. She'll rotate the camera around your spine to be able to give us a good picture of where the nerve exits the spine. That's actually our target. So we'll numb up the skin once we're in good position, and a needle is going to be placed slowly down into that space where that nerve exits the spine. As we move the needle, there's a series of pictures that is taken so we can literally see the needle in real time. When we get down to the space where we are confident the nerve is at, we're going to inject just a small amount of contrast. Contrast is just a little bit of dye that shows up well on the X-ray machine, and it gives us a good idea of where the medication would actually flow. If the flow is along the nerve, very simply, we just change out the syringe. We're going to hook up the medications, which are just some numbing medicine, some saline, and some steroid. Over about the course of 10 seconds, the medication will be injected along the course of the nerve. It can be possible at that time to feel some mild leg pain, but for most people, it's just a small amount of pressure in your low back, and the injection is done. At that point, the needles are removed and a small band-aid is placed on your back. We'll then help you off the table and escort you back into the waiting room, where we'll just make sure that everything feels right to you and that your vital signs are good. Typically after a lumbar epidural injection, what we expect is within 2 to 3 days, we expect your pain to decrease significantly. It's common for people to take up to a week though to improve after that injection. Typically, we're going to see you back in the office approximately 2 weeks after the injection and see how you're doing.